Hello everyone, this is Dr. Sam, and today we will learn about cystitis on ultrasound. Cystitis refers to the inflammation of the bladder. We will study its ultrasound findings. On the left is a normal ultrasound image of the bladder in the transverse plane. It is fully distended and appears anechoic. Its wall is smooth and normally measures less than 3 millimeters in thickness when the bladder is fully distended. This hyperechoic layer is the bladder wall. When the bladder is inflamed, you will find increased wall thickness. There will be diffuse bladder wall thickening. Thickness will be 3 millimeters or more in a fully distended bladder and 5 millimeters or more in a partially distended bladder. Here you see an increased wall thickness of the distended bladder. The wall looks thicker than the wall in the normal image. You can compare its appearance. The thickening is usually uniform and symmetrical. It may appear hypoechoic and heterogeneous. These images are in the longitudinal plane. In this case of cystitis, internal echogenic debris is found in the bladder. The debris contains pus, sloughed epithelium, and inflammatory material. This debris moves with changing patient position. The bladder wall appears thick and somewhat irregular due to inflammation. Here is an image in the transverse plane showing echogenic debris consisting of blood, pus, and inflammatory material in a severe case of urinary tract infection. This image shows a very thickened bladder wall. This is in a post-void bladder, so the bladder is only partially filled, hence the bladder wall appears very thick. The abnormal thickness of a partially filled or post-void bladder is 5 millimeters or more. The wall appears a bit hypoechoic and heterogeneous due to inflammation. In this image, you can see severe bladder wall thickening. The thickening is diffuse. Emphysematous cystitis is a rare type of cystitis in which there is gas in the bladder. It can occur in diabetic patients. In this type, you will find echogenic foci in the bladder lumen with dirty, gray-colored posterior shadowing. You will also find reverberation and ring-down artifacts. These features indicate the presence of gas. The wall thickness is also increased. This is another case of emphysematous cystitis. A bright linear echogenic structure is seen on the anterior aspect of the bladder, with dirty posterior shadowing filling the bladder lumen. These are classic features indicating the presence of gas. Thank you so much for watching. Stay tuned for more imaging videos.